Good evening. On behalf of the Cleveland Clinic Community Care, we want to welcome you to the Imam Roundtable COVID-19 Vaccines in the Muslim Community Program. I'm Dr. Shazam Hussein, and thank you for joining us for this important conversation. Today, I'm really happy to introduce our distinguished panel, which includes Imam Musa Sugapong, a senior faculty Immersion Shaykh al-Hind program, from Dr. Ahmed Mansoor, who is a renowned sleep specialist in the city, as well as the director of the Cleveland Ibn Sina Free Clinic. And of course, our very knowledgeable colleague, Dr. Michelle Medina, the Associate Chief of Clinical Operations at Cleveland Clinic Community Care. Thank you again for agreeing to participate in the discussion today for all our panelists. Just to give an introduction to our audience today, this session is going to be a question and answer format. I will be asking a question to one of the panelists and allowing them a chance to answer. The other panelists may, jump in to offer some comments as well. But we're going to ask everybody to kind of keep their answers in the interest of time and making sure we try to get to as many questions as possible, try to be nice and succinct with those questions. For our audience, if anybody does have questions, please do type those into the chat box. We will be reading those and answering them live. We'll try to answer as many questions as we can or as possible. And also, this meeting is being recorded, so we will be having this available for viewing later on. Again, the purpose of this virtual event today is to really engage with this expert panel, including our medical community as well as the faith leaders in the Muslim community, to better understand the COVID vaccine hesitancy that might be out there and offer also the latest information, trying to improve understanding of vaccine safety and efficacy, better understand and dispel fears that the community might have around vaccine safety and religious sensitivities, and emphasizing the importance of why vaccination is so important here. So welcome to my panel. I'll start off, I'm going to ask Dr. Medina the first question here. And really just a broad view here. I wonder if you could just advise us all about why vaccination for COVID-19. Why is this so important?
Thank you. And again, thank you so much for having me tonight. I really appreciate the opportunity to speak to this group and be with this very distinguished panel. At the end of the day, when we think about all of the safety precautions and all of the interventions that we put into place to help us get through the pandemic, vaccinations, if you think about it, is really at the end of the line. We've learned how to mask, in public. We've learned how to socially distance. We're very good about hand hygiene. We've rearranged a lot of things as far as our movement in public and as far as how we conduct our household. But at the end of the day, in order for us to get out of this pandemic and into what the future will be, whatever that new normal will be, vaccinations represent really the most effective and efficient way to be able to do that. And so in as much as we can ask as many members of the public to avail a vaccine when it becomes available to them, it really allows all of us to return to that level of normalcy.
Great, thank you. Thank you for that. I'll next turn to Imam Musa. I wonder if you could quickly comment about maybe the Islamic perspective in this kind of situation. We're talking about pandemics as well as vaccination. If you could offer some thoughts from the Islamic perspective. I think you might be on mute still, so. There we go.
Yeah, I'm not as professional as Dr. Medina, so following suit, I'm also grateful for the opportunity to spend some time with this panel, and I hope it's a source of benefit for myself and all of us and all those listening. I begin with the name of God, the all-merciful, the mercy-giving. I send peace and blessings on all of his prophets that came from the beginning of time until the final messenger. Peace and blessings be upon all of them. When it comes to vaccinations and medication in general, Islam is very accommodating in that regard. So there's usually two extremes when people think about these type of issues. One of total reliance, and then one of being in total control. And you will typically find that most things fall somewhere in between. So while as Muslims, we believe that God is in total control, and I'll use God and Allah interchangeably, as Allah is just the Arabic word for God with a capital G. while Muslims believe that God is in total control, we also believe that there's a system in place for which to live by. And we also know that there are factors and means through which things happen, without losing sight of the ultimate cause and the first cause, which is God Himself, which is Allah. We are allowed to use, and in many cases, encouraged, and in other cases, even necessitated to use those means. So, vaccinations, again, and medication in general fall under this type of a category where it's not something which conflicts with having trust in God. You can still take a vaccination, you can still take medicine while having full faith and trust and reliance in God alone. So, in short, that would be kind of the gist of our position as Muslims when it comes to taking vaccinations. And I think primarily just trying to clarify any misconceptions that even those in our community might have, that somehow if you take this vaccination, then you're not truly trusting and relying on God.
Thank you. I think it's a really important perspective and important information to get out for our communities. Dr. Mansoor, maybe I could turn next to you. And I know you've been doing a lot of work now with the free clinic and now the vaccination drive at the through the Ibn Sina Clinic and ICC. I wonder if you could maybe comment about what you've been hearing, or what are the top concerns driving some vaccination hesitancy in our minority communities, especially in the Muslim community, and maybe what, if you have some perspective on what might be done to mitigate those concerns.
Yeah, I think that initially the concerns were about the accessibility. I think a lot of people that who are not savvy on the internet, going to the different websites, running around, and and there was a lot of I think at that time individuals have comorbid conditions, diabetes, but their age group is not still 55 or 65, 60. So they were very, very concerned that despite the fact that they have underlying diabetes or obesity, which make them a high risk, can they get early on the vaccination? So that's where the first, I think, concern. A lot of calls around that area. And so that was one. Coming back to the hesitancy, I think that the question was mostly about this effectiveness, how long, how effective it is, and also about the effect on the RNA or DNA. That whether this vaccine basically will affect your own body DNA. That was a frequently asked question. I think and then the other ones, the most commonly I think asked, which is basically have been bounced around all over the place, is what happened. The fasting month is coming up. I think Ramadan is a very, very important issue. And now if you are getting the second dose, if the fasting month comes, then what will happen? And I think that those are the sort of main concern. There are, of course, the issues about whether there's any fetal product, that was the issue basically, which was also raised by the Catholic churches. And when the Pope got the vaccine, I think people basically feel that this is not something that is of a concern, that it's a fetal issue was involved in the vaccine. And then other sort of a mundane kind of these questions, if there's an alcohol as an ingredient, you are injecting it, you're not drinking it. So those are the kind of questions which I think they're not just of it, some are purely religious, nobody asked me about the nanotechnology of chip being injected into the body so far. I think that has become almost like a joke. So people maybe they still have the doubts, but I didn't hear anybody asking that question.
Great, thank you. And I guess just to then, open up that conversation to the rest of our panel. I know, Dr. Medina, maybe you can comment a little bit about that question about the efficacy of the vaccines, what the different types. I know there's been questions about what are exactly these different types of vaccines and maybe their efficacy.
Right. So at the moment, in the United States, we have 3 vaccines that have been approved by the FDA for use and for distribution. So everybody's aware of the Pfizer and the Moderna, both of which are the messenger RNA vaccines, and then more recently the Johnson & Johnson one, which is also a product that delivers viral DNA, but it's a different methodology. I think to address the very first question, and I've heard this as well, Dr. Mansoor, regarding whether or not it changes our genetic makeup. And the bottom line answer is no. What we're actually doing with these vaccines and what the technology has allowed us to do is, number one, know exactly what we're dealing with. We know exactly the genetic makeup of these, the corona virus. And so by knowing that, we're much better able to actually develop a response to that using the vaccines. And so what we do is we take pieces of the virus's genetic makeup and actually recreate those with the messenger RNA and the actual viral DNA as the byproduct. And then when that is delivered to us through a vaccination, what our body does, what our wonderful immune system does, is it takes that particular copy. And you could think of this as a fax machine or a Xerox machine, where you basically lay the product and our body actually just makes many copies of that. And then when you're done with that particular copy, you take that original and you just shred it, which is essentially what the body does with the messenger RNA that we were given to begin with. And those copies that were made are not copies of a virus. We're not creating virus. We're not creating anything that will give us the disease. What we have instead are copies of the virus's protein that now allows our immune system to recognize it, make the antibodies, the things that we fight it with, grow the cells that will become armed, so that if we ever encounter the coronavirus, we know what to do. We know how to attack it. We absolutely have a way to actually fight it off and not get the infection. So bottom line, no, it does not actually change your DNA. In terms of effectiveness, it's really wonderful that we have these vaccines where the messenger RNA ones are 95% effective as far as preventing disease. Johnson & Johnson is in the neighborhood of about 70%, especially in the United States trials. Please remember that when we started this journey, the FDA was going to be happy with 50%. And the fact that we came up with 95%, 70%, that is really amazing in terms of being able to develop vaccines that are that effective.
I think these vaccines are quite impressive, I think. And then, as you said, we were aiming for 50%, we're getting 95%. A little plug as well is, of course, for Muslims, we're always proud when other Muslims are involved. One of the vaccines was actually, well, Muslims were definitely involved. There were some of the scientists were Muslims who created the vaccine, which is always nice for our Muslim community to have some pride, and we're contributing to this science and contributing to what's been going on. Just a quick plug again, any questions that people have, please do offer questions to our panelists here. I'm going to keep moving. We're getting a few questions coming in. I'm going to keep moving through the questions. I guess you're going, Imam Musa, maybe the other part of Dr. Mansoor's concerns that he heard was, of course, our blessed month of Ramadan is coming up very, very shortly here. We're going to be, inshallah, being able to fast and get back to reflecting and getting closer to Allah. But certainly the vaccine has been, definitely a concern I've heard also from many people. I don't know if you could maybe comment a little bit on this particular situation of the Ramadan being there, fasting, and how the vaccination might kind of, interact with that. So.
Right. So regarding the holy month of Ramadan, which is right around the corner, there are differences of opinion regarding injections while fasting. And Islamic jurisprudence is something very nuanced. It isn't always black and white. And you will find quite a bit of latitude amongst these opinions. So in one of the primary schools of jurisprudence, in the Hanafi school, injections do not break your fast. So other schools of jurisprudence, it will break the fast, such as the Maliki school. But in cases like this, there may be exceptions for persons and people to take the lighter opinion. And me personally, when people ask me, because I predominantly follow and adhere to the Hanafi school of jurisprudence, I'll advise them and let them know that it's okay. So that's something which they're, at the very least, it's differed upon. And people, if they can wait until after the month of Ramadan, it would be optimal, but it would be completely also acceptable, especially if this is a time where they are a little bit more vulnerable, maybe elderly, people who are immunocompromised, others who may be a bit more concerned because they are frontline healthcare workers, or people who have to engage with people who may be a little more vulnerable, caring for their grandparents or their mother or their father. So even if they themselves may be in good health and maybe a little bit less a little less vulnerable, they should still consider taking it in many cases, because the vaccine is not just to protect ourselves, but it's also to protect others. So that's one important point about fasting, right? Now, I did want to point, because Dr. Mansoor did mention one issue regarding some of the vaccines which use fetal tissue, right? And there was more of an uproar, I think a lot more publicity with the Catholic Church. But in Muslim bioethics, that's also something which would be problematic and unethical. So in the absence, perhaps, of an alternative, there would be leeway also to even take that vaccine, which is found in the Johnson and Johnson. But if we have access to the Pfizer and the Moderna, that would be optimal. And that would be some, because they don't use any of that human tissue. And any of the physicians and experts on the panel here can correct me on anything that I say that is incorrect. So if that is something that can be accessible, and in many cases where we have some influence and we can maybe impact what type of vaccines we access, we should really do our best to access those which do not deal with any human or fetal tissue. Otherwise, again, if there weren't any other alternatives, or if only the Johnson and Johnson was made available at a particular time, then my understanding from some of the Muslim physicians who have training in Islamic sciences have also mentioned that none of those human tissues are found in the final product of the vaccine, right? So it is not considered impure whatsoever. It would be halal or permissible to have that vaccine administered to yourself. Again, I'm referring to the Johnson and Johnson. However, because of the process being unethical, it would be best to avoid that.
Great. I don't know, like, again, the question was coming up about other components of these vaccines. I don't know if Dr. Mansoor or Dr. Medina, if you know, in terms of the components, I know people have come up and asked questions, well, is there pork in the vaccine, or is there alcohol in the vaccine, and what are some of the components or ingredients, so to speak, in the vaccine, if that is of any influence? So.
Certainly no pork in the vaccine, and I would agree with Imam as far as the truth about fetal tissue being very, very removed from what we currently have as a product that is available to the public. In terms of alcohol, certainly none of the alcohol products that we would be concerned about. If somebody were to read through the ingredients, they would probably see ingredients that sound like alcohol, which are truly not alcohol. They're simply some of the ways that we keep the vial stable, but they're not typically what you would expect as far as alcohol products.
Great. So again, if we could, again, any questions, please, as an audience, please continue to ask questions here. A lot of, maybe I'll ask Dr. Medina again here. A lot of questions have come up now about these new variants that are coming,
Yes.
you know, from all over the world. We're hearing about variants out of the UK and Brazil and South Africa. I wonder if you can maybe just make some comment about the variants that are out there, and how they may be kind of influencing what's happened with COVID here, as well as with the vaccine itself, and how they may be impacting the vaccination. So.
Absolutely. And I think bottom line answer to that is the presence of the variants does lend a certain amount of urgency to getting as many people vaccinated. So it's not unusual for viruses to mutate. We expect viruses to mutate. That is why every year we get a flu shot, because every year there's a certain amount of mutation that happens with the circulating influenza virus. And that's why we have a shot that's more specific to what's circulating. So we're seeing that with the coronavirus, and certainly we're seeing it pop up in different parts of the world. And some of the things that are happening in certain parts of the world, we're also seeing replicated in other parts of the world, meaning that the virus is finding ways to mutate that's actually effective for it to go from one person to another. At the moment in the United States, the variant of concern that we see is the B.1.1.7 variant, which was originally found in the United Kingdom. We're concerned about that because it is much more transmissible. It's easier to give it from one person to another compared to the original strain of coronavirus. We have a few of the other variants, the South African one, along with the Brazilian one, but really the predominant one is B117. As far as we know, the 3 vaccines that we have are fairly effective against the B117 strain. As far as we know, that is the case. And that's been proven in real life situations. We have other countries that are further ahead in vaccination and they have B117 circulating and they're still able to see that they're able to prevent COVID vaccine in the population. But again, the fact that this is happening and it is happening, with some amount of speed does lend an urgency to having as many people vaccinated.
Great. There was a question, I guess, for Imam Musa that somebody wanted a bit of a clarification. And you made a comment, I think, about the injections that, according to the Hanafi school, it's acceptable, but you said it was optimal to wait. I wonder, they just wanted a bit of clarification about what you meant by acceptable but optimal. Why is it optimal to wait? So.
Right. So I saw that question as well.
Mhm.
Because there is a difference of opinion, it would be optimal to wait to avoid any type of difference of opinion. And again, I did mention that this would be in a situation where a person wasn't as pressed to take the vaccine, and there is that leniency to take it. So optimal is very different from even, for example, something which isn't, 2 things can be perfectly acceptable and one is better, right? So I don't want it to be misconstrued as something being suboptimal means that it's not good, right? So 2 things can be good, but one can be better. So whenever there's a difference of opinion regarding an issue, whenever you can take the more cautious position, this is always optimal, in a vacuum at least, right? Now, if there are other factors that you have to take into consideration, for example, I take care of my mother who is vulnerable. I myself am asthmatic and, I have respiratory issues. Then take the vaccine in Ramadan, even though you're fasting, because it won't break your fast.
Mm-hmm. Yeah, I always, I'm not obviously a scholar, Imam, like yourself, but I always found beauty in our religion that we have these kind of flexibilities that are there that, Allah, it's His blessing to us really that He allows us to be able to have this kind of flexibility. So I appreciate your comments on that. So
of course.
Dr. Mansoor, maybe I can turn to you for the next question. Again, in the work that you've done with the free clinic, I know you're always working with communities that are, may have challenges. What things do you think are helpful in terms to mitigate some of the barriers we have, things like transportation, lack of internet access to register? Are the things that your clinic is doing maybe, or that you think might be helpful to getting people more access to these vaccinations? So,
Sure. I think that organizing the event right at the mosque, I think it speaks exactly the type of the problem that you pointed out. Uh, Individuals make it to the mosque, they come with a relative, with the friends. It's a accessible place. You get hundreds of people basically visiting every week. And and also that we, in a way, the program which I'm describing, the program that which ICC, this is the first program we did, that is the Islamic Center of Treatment. We made it the registration process relatively very, very easy. I think the neighborhood family practice and Cuyahoga County health people, it was sort of a partnership, beautiful model. So we make it very easy that if you cannot basically fill up the forms, you can just, very simple registration. You can call and they can be called back. And then we also basically have the, I think, opportunity for the people to just come in. And if we, have a space and all that. So that's, I think, so that is one, what I call the accessibility issue. And the other is I think by having it at the church, at the mosque and synagogue, it speaks volume about the religious sensitivity. When people are basically getting vaccinated in the shadow of their religious sanctities, I think it just create a new message to the people, which I think no lecture can do that. Say, wow, I think it must be halal. It must be kosher if the synagogue is doing that one over there. So I think that was a brilliant thought process, that taking these, I think, vaccines to the very place of the worship to address this religious sensitivity. And so I think that's I think that then they're familiar. There are people over there, the volunteers, they are familiar. I think they relate to them. I think the creating that space is very, very important, because sometimes what people say, they are reflecting their anxieties. It is not they have a logic. So we have to sort of listen. I think to what they are saying and all that. And we have to give them the secure place, and no better place can be where they are familiar at the mosque, their peers and all that. They can talk, they can basically speak their mind. So that has been, I think, in my opinion, is I think one of the best way of to penetrate these communities. And I think we are reaching out now to the refugees community. I think specifically that who still, I think, despite so many years shutting down in the United States, they basically struggle, I think, to socioeconomically and all that. And so focusing on that one, I think, because a lot of those, the Afghanis, Somali, and Syrian, I think they're very familiar with the mosque because there are a lot of activities go around that one. So I think that is hard to reach least resourceful population, and then you bring the mix of the religion. So I think this is what so far I think we are very, very pleased that we are doing that one over here. We plan to, I think, hopefully expand to do that with Imam Abbas, and I think that he is in the audience. I think Imam Abbas represent one of the oldest mosque in east side of Cleveland, Afro-American community, and hope is that we can combine it with local church over there. And there we have a dual issue, with the Afro-American sensitivity. They have their own different side effect concerns, but by taking the vaccine over there, having the priest and imam together, so you're creating the space for people to talk about what exactly. And we have to remember that a lot of this group, which you really want to focus on, or we call the hesitant group. They are not the dead enders. I think don't start with the dead enders. You will get tired, exhausted, and get upset and yelling and shouting. But these 22% we call the swing voters, they are just watching what happens, I think, and they usually see oh my God, other people are taking it. It must be safe and sound. And so that is, I think, my little take so far, that what I have observed in our community.
Yeah, I think that's great. I think you're absolutely right. Because look, this COVID situation it could be quite frightening. People have had their lives very, very disrupted, and there's a lot of misinformation, unfortunately, that's out there. So having places where people kind of places that they trust, our religious centers, community centers, other places. I think getting people together at those places and being able to offer them, good information, hopefully that helps them make good educated decisions, I think is really valuable. So again, encourage the audience, any questions you have. We have a great panel here, really insightful. I've been really enjoying the conversation and very insightful comments from all our panelists. Dr. Medina, questions come about, are there any known, people are maybe concerned about longer term side effects from the vaccines. Do we know much about long-term side effects yet? And if so, is there any concern there yet? So
I think we all have to remember we started vaccinating just in December, and it's only barely April. So in terms of long-term side effects, I think we're going to have to wait and see. However, we have given over 97 million Americans at least one dose of the vaccine. When you have numbers that big, you would expect that if there were serious side effects, you would start to see them bubble up. The other thing to remember is that just because these vaccines were authorized under an emergency use authorization doesn't mean that we stop studying them. In fact, there is no vaccine that exists today that we ever stop studying. We continue to monitor them. We continue to look for signals to see if the measles vaccine that has been decades old, will have any issues. So these trials will continue for a period of 2 years. And then beyond that, there's a whole infrastructure that the CDC, Department of Defense, the FDA, the government actually puts together to make sure that we recognize any signal that there are bad side effects.
And I guess just to reiterate that, as in terms of even short-term side effects, people are having some maybe immune reactions when they, a little bit fever, chills, especially with the second dose we've heard. But overall, the safety, the vaccines have been very, very safe. So
have been very, very safe. Correct.
Another question has come in. How long is the vaccine good for? I guess how much will that efficacy? Do we know how long the efficacy lasts? There's been a question about booster doses, whether that'll be needed or not.
Yeah. As far as we know from the trials, because they were followed for at least a period of 3 months, the antibody response is robust at least through the time that we've been measuring it. We do expect that that will continue. There's no reason for us to think that it's only 3 months and then it goes down. We actually expect that that will continue as well. In terms of booster doses, I think that question is still up in the air. Both Moderna and Johnson & Johnson actually do have ongoing studies to see if a second dose of a Johnson & Johnson product or a third dose of a Moderna product will be needed, especially against the variant. So I think we're going to be seeing that data sometime soon.
Shazam, can I ask a relevant question?
Yes, please do.
I mean, so they are of course working through the different mechanisms, both the Pfizer and Moderna mRNA, and then the Johnson & Johnson work through the DNA. So when you are, let's say that the scenario that you basically in the wintertime, just like a flu, that you have to go back to the vaccine. Is there any reason that if you have gotten Johnson & Johnson today, you should always get the Johnson & Johnson for the booster dose? That was one of the questions, which I think was very, I think that the intuitive question. So I would just want to ask Dr. Medina that is there any reason to change the vaccination booster dose from this to that?
That's a really good question. The CDC actually leaves that question open. So for example, if you happen to get a Pfizer product and for some reason you couldn't get the Pfizer second dose and you got a Moderna second dose, they would consider that a completed series. Or if you have a Pfizer first dose and you couldn't get anything but a Johnson & Johnson as one dose, they would also consider that as a completed series, right? I think we will certainly know, again, a lot of studies will look at these vaccines head to head, so to speak. They will compare people, from one cohort to another. Those studies are still forthcoming, but there's a lot of leeway that we currently give people as far as the vaccines that they are receiving. One, because our demand still pretty much outstrips our supply, and we just want to make sure that people are able to get to a vaccine at this point.
Great, thank you. Another question's come in from Jamal. He's asking about, do you think kids will be getting vaccinated anytime soon? And maybe we can comment about some of the trials that are going on for children. So it's probably Michelle again. I think Dr. Medina, you're up again.
Right. So as of this morning, we heard from Pfizer that they have initial results of their cohort of 12 to 15-year-olds. And that, in fact, in the group that was vaccinated, so they had a group of close to 3,000 kids. And in the group that was vaccinated, they did not see any COVID infection. In the group that was unvaccinated, they saw COVID infection. So again, remarkable results, very promising. They will certainly go back to the FDA and ask for approval to expand the use of the Pfizer vaccine to 12-year-olds. We expect that Moderna is doing the same similar study, and we do expect that they probably will have very similar results compared to the Pfizer. So again, really, really promising as far as having a pediatric vaccine come soon.
Excellent. I guess there's a comment from our great panel that's feeding us information here as well that they're probably predicting right now, maybe it's going to be, obviously there's still time for rolling out, they have to get their approval and things like that. So probably for younger patients, we're probably not looking until a little bit later, fall or winter, maybe that
Right.
if all goes according smoothly, right?
Yeah, I think less than 11, jury's out on that one. Once you start getting to those ages, you actually proceed a little bit slowly. You start looking at cohorts, going down in age. So that really may take a while as far as getting below the age of 12. But at least for the 12 to 16-year-olds, I think we can expect that sometime this year.
But it's a very tough study. I think to begin with, that most of the kids don't even get symptoms. And even when they get symptoms, they're so mild. And in order you need to have a very large number of subjects to power the study. So 3,000 is not going to cut it.
Yeah, and again, that'll be up to the FDA to decide if that is enough. One way to also look at that, when you look at the original Pfizer trials and you look at the different age cohorts, the cohort that was above the age of 65 was only really about close to 5,000. Right? I think 4,000 or 5,000. And yet, because it is an emergency and they feel that it's safe enough and the benefits outweigh the risk, they felt that that was enough to actually be able to push forward with the EUA. They could certainly look at this evidence the same way.
Thank you.
Great. Another question here, and maybe I'll direct this to Imam or Musa or Dr. Ahmed. The African American community, the seniors seem to be quite on board with the idea of getting the vaccine. However, a lot of reluctance in our younger age groups, 25 to 45-year-olds. And so how, I guess this comes to a question, what's maybe the best way to discuss this with people that are maybe reluctant? What is our best approach maybe to talking to folks that, as you said, are maybe hesitant about the vaccine? Is there a good approach to that, or how can we get them? How can we address this issue? So we'll start with Dr. Ahmed, maybe, because your mic's on right now. So.
Sorry. Yeah. Well, I think that it is interesting that only today that Imam Abbas, I called him, I think twice, and we know each other, very good friends, and then say, Imam Abbas, we want to do this thing, we want to do that, and we want to do this thing. But then there was a quietness on Imam Abbas' side for 2 days, and I said, maybe he's too polite to say, Dr. Ahmed, So I said, what's the scoop? So do you sense a problem in the community and all that? And so he basically, I think, pointed out exactly, I think probably this is his comment and question, the young group, because they are absolutely, I think, as I said in the beginning, I think all the social media, which essentially is the epicenter of this toxic, I think, misinformation, malinformation, misquotation, you name it, I think they have it over there. And they have created the ecosystem, the WhatsApp group and the social group. So I don't know exactly. I'm not really even the expert, I think, to see that how we're going to, but again, I think that, as I said, applies to anyone, just listening to her. I think with Imam Abbas, probably they are comfortable. He has his own nice sense of humor. He don't wave the finger. You better listen to me. I think it doesn't work. He knows that. So I think is that we need to basically have the listening to her and this is a very, very important group, so I will say that, create the ecosystem where they feel comfortable. Don't basically tell them that, I know better than you, you better do it. That doesn't want to work. So, and then having some young people to come for the vaccination, it will create its own, I think the wait and see kind of a group will basically jump into that one. I think these are just common sense, without any experience in that group at all.
Maybe Imam Musa, I know you work a lot with the youth, and I think you have a good way to connect with them. I don't know if you maybe want to comment on this a little bit as well about, especially in this younger generation, if they're a little reluctant. I consider myself in that younger generation, by the way, still. I'm right in that age range, so that's good.
We will teach you different.
Well, we're all considered young compared to those who are older than us. So
exactly.
Well, one of the things, and I see another question here also that I guess kind of relates to this about imams advocating for the importance of vaccination. I think that's one of the things we're doing here with a forum like this, for starters. And education and publicity is something which can help with that. People maybe finding people who can advocate and promote it a bit, that they may feel more of a connection with, someone they can relate to, people who are maybe of similar backgrounds to them. That's something which is a basic principle of life, right? And even in our own religion, Allah says in the Quran that he never sent a messenger except with the language of the person or people that he's being sent to.
Mm-hmm.
And language is more than about just what you say, but the language represents a culture of a people. And you have to be able to relate to people. If people can't connect and relate to you, then you're not going to have as much cachet with what you have to say. So then a person, in any particular community, I guess, you want to identify those who are willing to stand up for something and stand up for maybe this vaccine in this particular case, and let them know at the very least that there's nothing wrong with taking it. Because I always like to understand things in extremes. And if you understand things on two ends of the spectrum, then you can always identify maybe the best approach, right? So it is important as Muslims that we don't make this an obligation. All right. So we don't have the authority to determine what is mandatory or obligatory in a religion. Now, is it something encouraged to do? Yes, you should do that, right? Because then there are some people who will say that you shouldn't do it, and this is actually something prohibited. It's haram because of the ethical implications, or because of the ingredients, or because of the conflict with having just trust in God, right? So we have to clarify those things. Make sure that that's not the case, because that's one extreme. People will say, I don't want to take it, and you shouldn't take it. You have the other extreme where people are on this a bit of um, a mission, I guess you can say, to make it binding on people to take. Okay. And I think it is important to also make sure that that is also clear. Dr. Mansoor mentioned like how that sometimes can turn people away when you take too strong of an approach to get people to do something when they know in their heart it's actually not mandatory or obligatory to do, and you're here trying to force them to do it. You have to allow people to feel comfortable to make that choice and to make the decision which will be best for their situation. And when it comes from their own self, when it comes from their own side, then I think that's the best case scenario. Um, so that's how I kind of look at that. So we have to remember at the same time where we don't want people to think that it's bad or somehow detrimental to take the vaccine. We have to also understand it's not an obligation. It's not a religious obligation, right? So as Muslims, yes, we should at the very least follow protocols, safety protocols in our society. So if we're being encouraged to wear a mask or even double mask or socially distance, or refrain from physical contact when not necessary with strangers, or having large gatherings in our home, then we should abide by those. As far as I know, up to this point, it's not like a government mandate that everyone needs to get vaccines. So neither from a religious nor from a government perspective is it an obligation.
Yeah, I think that's a great way to put it, and certainly, I think seeing, I like that idea of seeing it from both kind of extreme ends, but understanding that again, there's good rationale, dispelling some of those fears and concerns with knowledge and wisdom, and then really, I think, encouraging. I think that it really should be something that should be encouraged. A more practical question that one is asking is if someone gets sick as a reaction to the vaccine. Again, we've heard about that, particularly with that second dose. What is it about in terms of breaking a fast, or how can you decide when you should or really should break your fast in that situation?
Right. So it's another great question, and there's two things I would like to address with this question. The first and foremost is if a person is ill in general, be it from the vaccine or otherwise, they are allowed to break their fast. People have different thresholds for maybe pain tolerance and how they can maybe bear the difficulty of being ill and fasting. So there is some latitude there as well. You use your discretion. If you feel that, once you're sick, because it's something ambiguous, you don't have to be this sick, right? It says that if you're sick, you can break your fast. So there's some discretion there from the individual and what they're able to bear. And secondly, this ties into one of the other comments made earlier in the question when I was asked about fasting or taking the injection after Ramadan being optimal, right? This is one of the reasons why it would be optimal to take it after Ramadan, because you don't want to put yourself in a situation where you are now unable to fast, right? If you can wait. Now, again, just so people don't feel like guilt. I know people can be guilted sometimes into decisions. I'm not trying to like make people feel guilty and like if you take the vaccine Ramadan, then you're kind of selling out on your religion and it would have been better to just wait, right? There are legitimate concerns that people have, and you don't know with the limited availability if you'll have a chance again anytime soon. But the reason why it would be optimal if you didn't have any other pressing issues or factors to take the vaccine in Ramadan is for that reason, right? So for one kind of quick analogy is, are you allowed to play soccer when you're fasting or to play basketball when you're fasting? Absolutely. But if you're going to play outside in the sun for 8 hours of, running and sweating, and it's going to put you in a situation where now you're so dehydrated that you actually have to drink water, then um, it becomes reprehensible to engage in that type of activity where you're going to be incapable of fasting, right? To do something that you don't have to do that may now compromise your ability to fast is considered reprehensible. in our religion. So then the vaccine, again, there's going to be a bit of a spectrum of people on how how urgent and how pressing they need to take it, like this month in Ramadan. But if they're going to do something that would make them that may compromise their fast, then unless they have to do that thing, they should wait until after Ramadan.
I think that's a, it's an important point. I think Dr. Medina can maybe comment on this as well, but the recommendation from the CDC, is that really the second dose, ideally you want to do it between 3 to 4 weeks after the first dose, but they have said that if necessary, you could go up to 6 weeks. So that potentially does give a little bit of leeway for someone who, felt strongly about this kind of concern.
Correct. And really, even the first dose, we do have information from the CDC that even with the first dose, you do receive 80% protection. So yes, you do have some leeway as far as the second dose. It will be best to get it within that time frame, but certainly you have up to 6 weeks for an optimal response.
And Sheikh Musa, I guess another from an interest in your religious thoughts on this. There in Islam, of course, when it comes to illness and people being sick, we not only think about the individual, we think about the society and the community that we're in. We know hadiths from the Prophet. One of the very first public health people we say was the Prophet, because he used to say, if you're ill, you shouldn't travel from one region to another because you may spread the disease in another place. So I wonder if there's anything that you could comment from that perspective as well for protection of the community as a whole. Is there some rationale maybe there that could help? For the people that are maybe reluctant about getting the vaccine in general, that maybe it's not, because we hear this a lot that, well, as an individual, I'm a young person, if I get sick, even the chances of me getting really sick is really low. Why should I take the vaccine? But is there something there that we should be thinking more broadly about the community as a whole? So
Absolutely. So what you mentioned there again is very poignant, that the vaccine isn't just for yourself. Sometimes it's to protect others. So if a person isn't as vulnerable of maybe succumbing to the virus, showing my connection is a little unstable. I'm hoping I'm not breaking.
We can hear you fine. Yeah.
I'm fine. Okay. So if even in that case, they can take the vaccine to at least maybe prevent themselves being out of commission for a week or two. Some people think, well, there's the mortality rate is so low, especially in my age bracket. The chances that I'm going to get sick and die from this are very low. Well, fine. Even if you were to acknowledge that, the chances of you getting ill for a week and being out of commission is higher than it's not just about dying from the virus, right? So you should guard yourself against that. And then being a carrier of the virus and maybe spreading it to someone who is more vulnerable. So when it comes to, again, taking the vaccine, as I mentioned, it's permissible to do. Now, things that are permissible in our religion can actually become an act of virtue based on your intention. So now if a person, knowing that it's permissible to take this vaccine, but they don't have to, if they now just shift their intention and say, you know what, even though I don't have to take it, I'm going to take it because this may help protect someone from being infected with the virus, they would now become rewarded for doing it. It becomes an act of virtue just by having a good intention. So intentions are something which are very important in our faith. It's something which can impact the quality of your deeds and the quality of your actions. That's something which is maybe mundane, it's neither good nor bad, can actually become good because of a good intention. Mm-hmm. So yes, taking now that approach where the Prophet, peace and blessings be upon him, he advised people not to travel during a pandemic. Well, we're in a full-blown pandemic. So taking precaution to make sure you do not infect other people is from the prophetic teachings. So if you take that approach and that intention that I'm going to take the vaccine so that I can prevent any potential spread of the virus, then you can actually, that permissible act can become an act of virtue.
Yes, thank you. Very, very eloquently put there. So just looking at the chat box here. We do have a question. I guess they're asking if there is a specific fatwa. I'm not aware of anything from any of the major schools, or maybe Imam Musa, you may know better than me about. Is there an official Islamic ruling on any of this that exists in the world, or?
Yes, yes, absolutely. So the institute that I teach for, Dar al Qasim, they have a fatwa on their website. And this is consistent with some of the other fatwa, and fatwa is an Islamic ruling that is issued, usually dealing with, in many cases, contemporary issues that maybe didn't exist during the time of the Prophet Muhammad, peace and blessing be upon him. So then precedents are identified and rulings are established on these contemporary issues. So their position, again, was similar to what I conveyed. This isn't my own conceptualization or my own judgment. Rather, it's based on a body of scholars and physicians who have consulted about these things, and they have expressed that it is unethical to use fetal and human tissue in the process of developing the vaccines. So for that reason, it would be, in the presence of an alternative such as the Moderna and the Pfizer, those vaccines which use human tissue, such as the Johnson and Johnson, should be avoided. That's the fatwa on the vaccine. And then in terms of taking the vaccine in general, it's completely permissible. So like the Moderna and the Pfizer, there's no problem whatsoever in taking that. Right. And there was another question I saw on the panel regarding how do you answer the questions of a skeptic, right? And a lot of times we deal with these type of skeptics, especially in the field that I'm in. And to quote the same founder of the Institute Dar al Qasim that I teach for, Shaykh Amin, he very beautifully said once that the questions of a skeptic will only increase them in their skepticism, right? So you do your best, but you can't change everyone, right? And if a person is asking because they really want to know and they really want to learn, then there's answers for people. There are answers from people. But if a person is asking to just, be a skeptic, we do our best, we answer, but we can't control their minds. Yeah.
Right. Thank you. Thank you for that response. We do have a few minutes left, so if you do have any other important questions, please, do panel. Well, another practical question that has come is, people have been talking about anti-inflammatory medicines and taking them with the dose. I don't know, Dr. Medina, if you can comment. That people are asking, is there a certain time that you should wait before taking an anti-inflammatory after getting, particularly that second dose, which seems to be causing more reaction?
No, there's really no data that says whether you take it with, before, or right after. It impacts either its effectiveness or the side effects that you're going to be getting. I think for the most part, since we do understand that after the second dose is when you're most likely to get those side effects, it would be good to have those handy. Yeah.
Absolutely, and I can tell you that I did take some anti-inflammatory after my second dose, and it was a bit of a reaction, but not something what other people have kind of described. So, let me just see if one other question. So, okay, well, just trying to see. There's a couple more questions that have come in here.
I think I can answer one regarding the age.
Sure.
There's a question regarding their child who is 16 and wondering if they have an option other than Johnson & Johnson. The only vaccine that's actually currently authorized for use in 16-year-olds is the Pfizer one. So if they have concern about Johnson & Johnson, they can certainly avail of the Pfizer one.
Okay, great. Pfizer is available. That's great to know. So, and hopefully, again, as we talked about, maybe later on, as these studies are coming out and getting some approval, we'll see other options or for younger patients as well. So, good. And then another question: do we recommend that the whole family get the vaccine at the same time, if that's available to them? So,
I would say yes. Household transmission is probably the highest, or the most risky way that you could pick up COVID. So as much as you can vaccinate the whole family, I would definitely advocate for that.
great. Vaccine. So, okay, well, maybe, I know we're running close to time. I don't know if there's any maybe final comments we can ask from each of the panelists. We'll maybe start with Dr. Ahmed, if you have any final closing thoughts for the audience here. So,
Well, I think that it's the whole thought basically of having the symposia was to provide. It was essentially focused at our imams. I think to empower them what we little know and share that sort of our experience and to see the imams. It started with actually of our imam that I after Friday prayers he asked me that Dr. Ahmed, what do you think about the vaccine? A lot of people are asking the question, and I don't know how to answer that one. And then I essentially called. I sent an email to Dr. Donald Malone. I said a long-winded email. My emails are very long, and he always sent a very brief answer. Okay, Dr. Mansoor, we're going to connect you with Dr. Medina, and that's the end of it. Then you get whole bunch of emails. So I think that so in a way, I think this interaction between the academia and the people in the community, particularly in issue and pandemic, is so critical, so important. And I do hope that this symposia basically allows us to expand, our interaction in the future for issues related to the pandemic. So I really, really appreciate all the effort, Lisa, Tom, Dr. Medina, and you, I think, to putting it all together. And I'm honored, and I think well accomplished. I think it was a lot of work, a lot of Zoom meetings, a lot of conferences back and forth, and getting the emails. So I'm very grateful to have this opportunity and honored to be here.
Yeah, I certainly would echo that. Lisa, Tom, all the others that have really done a huge amount of work in getting this organized. We thank you for those efforts. Dr. Medina, maybe I can ask you to do some closing thoughts. And
yeah, completely agree. Thank you again for the opportunity, and certainly, happy to answer any more questions that people may have. I would just like to end with this. We all have many reasons why we would like to be vaccinated. There are individual reasons why we would do it. We want to be protected. We want to get back to normal life. But I, as a pediatrician, and certainly I, as a member of the community, I go back to that larger goal, that larger motivation, which is we need to also protect each other. And really, if this is one other way that we could do that for each other, I would really heartily encourage people to take up the vaccine.
Great, thank you. And then Imam Musa, I'll give you the last word here. So,
well, one thing then, being, I guess, in a position of religious leadership, like it or not, our job is to reflect on these type of things. We didn't choose how we came into the world, and we don't always get to choose how we leave. And this was a reminder about that. I think we've all had some loved ones and some friends and people that we've probably lost to the virus. And we saw how the most powerful country in the world basically shut down. And oftentimes we don't like to be told what to do. And sometimes this is some of the biggest objections against religion in general, is like, why do I have to live a particular way? It's my life. Well, this is a reminder that we actually aren't in total control. And it's a part of life, actually, that sometimes you have to defer to something greater than you. And in this case, it was a virus that we can't even see with a naked eye. And it shut down the most powerful country and many countries throughout the world. And it's a reminder again that we appreciate the things that we have, and that one way or another, we're going to be made to realize that we're not always in control. So we can do it willingly, or we could be compelled to do so. And if we do it willingly, then you will be rewarded for that. And if we're compelled to do it, then unfortunately, by then it's too late. And we pray that, again, this is a way to help us come back to realization of our merciful God, and to be reminded of our duties in trying to live a life that's fulfilling to that God.
That's great. Amin and Jazakallah khair for those great comments. Good. Thank you to the whole panel. Really, I think an excellent, great conversation. This will be recorded, so I think it will be available afterwards. If anybody, if you've been a part of the podcast, you've enjoyed it, this session, please do share it with other people around. I think we do really want to make sure this information gets out to as wide an audience as possible. Tom, I don't know if you have the slide deck that can just do the quick wrap up then. So again, we hope that the information shared today from these trusted voices will help you make an educated decision about receiving the vaccine when it's available for you, and stimulate conversations with those that you're around. The vaccine, of course, from our perspective, can greatly reduce the risk of severe illness and possibly death. At this time of great uncertainty, the Cleveland Clinic's goal is to work with arm you with tools and accurate information. We are pleased to work hand in hand to get you through this unprecedented global crisis together. Of course, again, as I said, the conversation doesn't end here. We have a variety of virtual events that will be ongoing. And of course, virtual events that can answer these community questions. Please look for these future communications for upcoming virtual events. There's also vaccine information that's available. You'll see on the slide here, this is the Cleveland Clinic COVID-19 vaccine website. So please avail yourself of that information there. If we go to the next slide, also want to make mention of the ICC with the Ibn Sina Clinic. They are providing COVID vaccination there. Really, it's coming up on many Saturdays. There's the registration address. Please feel free to go on the registration site, or of course contact Dr. Mansoor Ahmed. I know he's available to answer any questions about this clinic as well. Next slide. Again, as I mentioned, some upcoming virtual events that are coming up. So please, I think this is very useful information. So if you're interested, please do join us for these upcoming events. And lastly, just want to make a mention that the Langston Hughes Outpatient Care, this is now offering primary care services at the Langston Hughes Family Health Center Education Center. So we can leave that information up for a moment so people can get that information. This is located on, move this screen out of my way, 2390 East 79th Street, 2nd floor in Cleveland. And then lastly, to wrap up, we will ask, there is a brief survey. Certainly this information is very useful for people as we're trying to plan these upcoming events. So when you exit out of the Zoom session, the window browser will take you to that brief survey. If you could please, please take the survey, will help us in that information. Again, really, really great thanks to Dr. Ahmed, Dr. Medina, Imam Musa. Thank you so much for being a part of this conversation. It was really, I enjoyed it quite a bit. I think the information was extremely valuable, and really thank you all for your participation and your time.